There's one condition called physiologic anemia of infancy. So babies are born at very high hemoglobin, say 14 to 16 grams of hemoglobin, and the hemoglobin usually falls in the first 2 to 3 months. In preterm infants, there is a greater drop. The drop actually goes up to 7 to 8 grams and sometimes even less than 7 grams. This is actually physiologic, and in preterm infants, it is predominantly due to decreased erythropoietin response. Erythropoietin is the facilitator for RBC production. So when anemia is there but erythropoietin does not respond to the level of anemia in preterm infants, physiologic anemia results. And also sometimes erythropoietin can be metabolized very increasingly. So this is why preterm infants have a greater fall of hemoglobin, and this fall happens pretty early, that is around the 6 to 8 weeks of age. Whereas in the term infants it happens pretty late. I have discussed this physiologic anemia of infancy in another chapter in detail as well. So coming to the RBC products and dosage. So what are the RBC products that we need to give to the child? Pre-stored leukocyte reduced RBCs are preferred. Usually they are suspended in an anticoagulant. The anticoagulant can vary from lab to lab. So pre-stored, how long can we store PRBCs, that is packed red blood cells? Up to 35 to 42 days. So maximum up to 6 weeks. In less than 1.5 kg, a very small low birth weight or a preterm baby, we need to give irradiated blood to prevent GVHD and other reactions. What is the dose preferred? It is 10 to 15 ml per kg. The more severe the anemia is, we need to start at a lesser dosage, say 10 ml per kg. Usually, RBC transfusions are given over 2 to 4 hours. What are the complications or issues that we can face with RBC transfusion? In neonates, especially when we are transfusing more amount of blood, say 15 ml per kg or 20 ml per kg, neonatal arrhythmias, deaths can also occur. Especially if we use an old aged blood, that is more than 35 days old RBCs are transfused and a large volume is transfused, neonatal issues are common. Apart from that, RBC transfusions come with side effects like transfusion associated infections, graft versus host disease.